My name is Michelle Howe, and I'm going to be discussing concepts of health and disease found in Chapter 1 of Port's Pathophysiology, 9th edition. So what is disease? Disease is the disruption or dysregulation of the body's normal physiological process. It can be acquired or congenital diseases. An example of acquired would be influenza, which is an acute disease process, or congenital, an example might be cystic fibrosis, which is a chronic disease process. So what are some causative agents or etiology of disease? They can be biological, physical, chemical, or nutritional. One example of a biological process might be genetics, such as found in sickle cell disease. Other examples might be infectious microorganisms, such as a virus, which might be like coronavirus, bacteria, which might be a MRSA infection, fungi, which Candida often cause, or prion, which is found in mad cow disease but is still being researched. So physical forces such as a trauma can cause fractures, or if you hit your head hard enough, if you fall or have a head trauma, can lead to subdural hematomas. Chemical agents can be alcohol, illicit or prescribed drugs, or exposures to pesticides, insecticides, or herbicides. Such an example of an herbicide would be Agent Orange exposure, which many Vietnam War veterans were exposed to, which can cause non-Hodgkin's or Hodgkin's lymphoma, to name two. Examples of nutritional could be excess or deficit. Excess might be as a nutritional or caloric intake, and that can lead to obesity, which in turn leads to the correlation of coronary artery disease or hypertension. Deficits, such as if you're not getting enough iron in your diet, can lead to anemia. So pathogenesis is different from etiology. Pathos, as our book shows, is the root word for disease. Genesis means creation. So how is the disease process created in the body? What is the physiological process that took place from the time of exposure throughout the disease course until the resolution of the disease? How do the tissues, organs, and cells physiologically respond to this disease process? These are all questions we would ask when addressing pathogenesis. An example would be HIV/AIDS. Some questions that you would ask regarding the pathogenesis would be, what changes happened physiologically at the time of exposure? What conditions had to exist? What does the virus do to the body or the immune system? When does HIV, when is it considered AIDS? And how does this lead to secondary infections? So pathogenesis is processes that are going on inside the body, whereas signs and symptoms are more things that are observed and felt by the patient or seen by an observer. Signs, for example, would be an objective symptom that an observer would be able to actually notice. So if you used pneumonia as an example, somebody auscultating their lungs may hear rhonchi, or if they were being monitored vital signs, they might have a low pulse oximeter because they're not oxygenating well. Symptoms are more subjective. They're more of what the patient is feeling, the person that's suffering from the illness. So again, we use pneumonia as the example. Shortness of breath or malaise may be examples of what the patient's feeling but can't be observed. So a syndrome is a combination of signs and symptoms that are commonly found together. An example would be irritable bowel syndrome. While the symptom or subjective part of that would be the patient having intestinal cramping many times, the more objective or signs would be if a medical team were to observe the person for a certain period of time, they could note the frequency and consistency of bowel movement. So diagnosis is the identification or the cause of the illness or health problem. So what's going on and how do we name it? What are the physiological findings and what are some signs and symptoms? We must gather information in order to come up with a diagnosis. If we use pneumonia again as an example, we need to know, is it bacterial, viral, fungal? We must gather the information. So if a person was suspected of having pneumonia, the medical team would perform a medical history. Were they exposed to a recent common cold or flu, or had they had one? Physiological exam might provide us with findings of bronchi, secretions, and again, vital signs as mentioned before. We would need lab data, like blood work might show us an increased white blood cell count, which is indicative of an active infection. Or doctor might use a bronchoscopy in order to collect a sputum sample, which can help ID an organism. Or they might use a chest ray to analyze to see if they find it correlates with pneumonia. Other diagnostic material that we might use would be like nuclear scanning, bone density, PET scanning, magnetic resonance imaging like is in an MRI, ultrasound, electrophysiological tests like an EKG, and angiograms. These are just to name a few. So prognosis usually comes after the data has been gathered and the disease has been identified, and the team tries to take into consideration what are the possible outcomes of the disease, if treated, if not treated. What are the possible complications, and what effect can they have on the outcome? For example, problems secondary to disease process or undesirable side effects of a treatment. So an example, if we're using pneumonia, secondary disease process might be a pleural effusion. This may possibly lead to sepsis or septic shock, and if untreated, maybe death. If we treat septic shock, which is part of the treatment for low blood pressure that is found sometimes in septic shock, we might be using vasoactive medications that can sometimes cause tissue ischemia and necrosis. It's also important when considering the prognosis that the team is taking into account past research and data on the disease that they've identified. They also have to take this information in context to the patient, patient's age, pre-existing health, available resources such as money, food, social support, healthcare accessibility, and medical insurance can all play a part in a patient's prognosis. So we see there are many aspects involved in identifying treating illness. If we follow the concepts and practice, the concepts that are found in Chapter 1 of Port's Pathophysiology, and combine that with following clinical practice guidelines, it leads to effective treatment for patients. Thank you.